Good morning, everybody. Today, I have declared a public health emergency to address the outbreak of COVID-19 in the state of Wisconsin. This declaration allows us to access state resources to deal with this pandemic head-on, care for those who need help, and also limit the spread of the virus. I want to assure everyone that those affected are receiving the best possible care and that all steps are being taken to stop the spread of this virus. Wisconsin, through the leadership and expertise at the Department of Health Services, has been preparing for the potential of a pandemic. Because of their diligence, combined with the experience and hard work of our local and tribal health officers and other partners across the state, the risk to the majority of Wisconsinites remains low. That said, we can all do our parts to help prevent the spread of the illness to others. It's always good to be prepared for emergency situations, whether they be due to disease outbreaks or extreme weather. So with that in mind, I encourage Wisconsin residents to be prepared, know the arrangements that are important to you if you miss work, school, or get your information from trusted sources like the Department of Health Services and your local tribal health office. And so thank you for your patience as this situation unfolds. Knowing that we are committed to addressing these issues with partners like the CDC, local and tribal health agencies, and healthcare systems, we've been doing that all along. We continue to monitor the situation and conduct disease surveillance for COVID-19. And you will know that when new information is available for your protection. Now, there are a couple things I would like to mention that have really been on my mind as we work diligently to manage this health emergency. One is food security. We have tens of thousands of folks in Wisconsin, including kids and older adults, who rely on schools and nonprofits in order to get their meals. Ensuring that those folks are taken care of is a top priority. I'm also deeply concerned about the homeless individuals and other vulnerable individuals in our communities. Our team will continue to work with our local partners around the state to ensure that we're able to support those folks who need our help. We've also got some important elections coming up, folks. The good news is that absentee voting in Wisconsin is really easy. I'm encouraging everybody who can vote early to ensure that your vote is counted and your voice is heard to take advantage of that. Finally, I want to state that Wisconsin has one of the most dedicated public health workforces in the country, and they are doing excellent work in addressing this virus. So with that, I'd like to introduce Secretary Designee of the Wisconsin Department of Health Services, Andrea Palm. Andrea?
Thank you, Governor Evers. I appreciate the governor's quick response in declaring a public health emergency to help the state free up the resources we need to contain COVID-19 here in Wisconsin. While we hoped this day would not arrive, the people of Wisconsin need to know that the Department of Health Services, our local and tribal health offices, healthcare providers, emergency medical services, and other of our important partners have been preparing for months to be ready for the time if COVID-19 pandemic reached Wisconsin. We are ready to meet this challenge, and efforts will continue until there is no more COVID-19 in our state. As of today, there are 5 confirmed cases of COVID-19 in Wisconsin and 1 confirmed case that has recovered. They are in Dane County, Fond du Lac County, Pierce, and Waukesha counties. All of these cases were exposed to COVID-19 while traveling. 5 cases are in isolation at home, being monitored by local health officials, while 1 person is currently hospitalized. We are working with our local public health departments in these affected areas to do contact tracing and notify anyone who might be at medium risk and needs to go into home isolation. We are also working to bring home 37 Wisconsin residents from the Princess Cruise in California who will be going also into self-quarantine in their homes. These additional cases and monitoring needs will put a large strain on our local public health resources. And we're grateful to Governor Evers and his leadership to make sure that we have the resources that we need for this work to get done at the local level to continue to help protect all Wisconsinites. Our goal is to contain COVID-19 and avoid its spread to other areas, which is why today we will also be issuing new guidance to protect Wisconsinites from further spread, including recommendations on travel, events, mass gatherings, and shortly we will also be providing some guidance for the elderly who are residing in long-term care and nursing homes. We understand that these significant steps are going to disrupt people's lives, but are making these recommendations to protect the lives of the most vulnerable members of our families, our communities, and our state. Our recommendations for events include canceling events with over 250 people. If your event has less than 250 people, we are currently finalizing guidance on how to think through a decision about whether or not to cancel your event. Additionally, we recommend against traveling to areas in the United States with sustained community transmission. If you do travel to places with sustained community transmission, we recommend you isolate in your home for 14 days. We will also recommend additional steps for long-term care facilities, including nursing homes and assisted living facilities, to protect those residents. As this is a rapidly evolving pandemic, our guidance will change. So please stay tuned, and we will make sure that you know of new guidance as it is available. With that said, I want to reiterate the best things you can do to protect yourself, your family, and your community. Those efforts include the things we have been talking about all along: frequent and thorough hand washing. Please avoid touching your face. Cover your coughs and your sneezes. Stay home if you are unwell. Refrain from shaking hands and enact other kinds of social distancing activities that keep you out of close contact. As with any outbreak or natural disaster, it's always good to plan ahead, as the governor suggested. If you haven't already done so, we encourage you to put together a two-week supply of food. Think about your medicines, your prescription drugs, your pets, and other plans you would normally think about putting in place for a natural disaster or other preparedness activities that you normally do. This advice is not intended to encourage the hoarding of supplies, but to keep you from having to go to a public place in the event that you become ill and need to isolate at home for 2 weeks. We want to make it clear also, and this is really important, that ethnic background has no influence on the risk of COVID-19. Only travel history or direct close contact with someone carrying the virus puts you at risk. I encourage you to visit our Wisconsin DHS website at dhs.wisconsin.gov for the latest information on the virus, resources for employers, schools, child care programs, and colleges and universities. Thank you, and now I'd like to turn it over to General Brigadier Matthews.
Good morning. I'm Brigadier General Joni Matthews, the Deputy Adjutant General for the Wisconsin Army National Guard. I'm here to provide a short update on the National Guard's role in supporting the Wisconsin Department of Health Services and our state government. Our National Guard always stands ready to assist our authorities in times of need, and yesterday the Wisconsin National Guard received a request for assistance from DHS to assist in transporting 37 Wisconsin citizens who are aboard the Grand Princess cruise ship back to their homes for self-isolation. We are mobilizing up to 30 soldiers and airmen to state active duty to serve as drivers and accomplish this mission. The flight carrying these citizens returning from the cruise will land at a location still to be determined, where they will be greeted by DHS personnel, and then drivers from the Wisconsin National Guard will transport them to their homes in state vehicles. Our Wisconsin National Guard personnel provide a ready source of manpower to assist DHS and other state resources in accomplishing this mission, which frees up their personnel to remain focused on their core missions. Supporting state and civil authorities in this manner is one of our core missions in the National Guard. This is not a security mission, and our soldiers and airmen will not be armed. They are merely providing the manpower and drivers necessary to assist DHS in getting these citizens home safely and efficiently. The soldiers and airmen driving our citizens home will be following CDC and DHS protocols to limit the risks to our own troops, and out of an abundance of caution, troops involved with this mission will self-monitor for 14 days following completion of this mission. Even though the individuals we are transporting have not tested positive for COVID-19 and are asymptomatic. The Wisconsin National Guard stands ready to assist the state in whatever way we can with additional missions if requested, and we are fully committed to supporting the state and DHS as we all work together to protect public health and safety. Thank you. I'll be followed by Secretary Palm for questions.
Secretary Palm, any decision made on all public schools? We've seen the universities and private universities say, go home and you'll learn online. Why not public schools and the elementary and high school?
It's an important distinction. I think one of the things that you will see in our guidance is around essential services and how we think about mass gatherings, proximity, numbers of people, and the ways that schools can remain open and will remain open using tools and tactics so that they can continue to do the essential functions that they need to do, which is to teach our kids, but also employ some tactics to improve the social distancing kinds of things that we talked about so that they are able to continue their missions.
Madam Secretary, what will these changes mean for the average person's daily life? These are potentially disruptive things for people's lives. We recognize that, and we certainly appreciate the partnership of the people of this state. I think the important thing to recognize about this declaration and about the foundation it lays for the guidances that we are releasing today is that we're at a moment, right? What we've seen around the globe, what we've seen here in the United States, is that a couple of cases can quickly become many cases. And so we have an inflection point now to lean in, to do some of these things in an aggressive way in an attempt to reduce the spread of COVID-19. That is really our focus right now. And so the importance of adhering to these recommendations, of being in touch with your local public health and your partners on the ground, and making thoughtful decisions about how you can help contribute to slowing the spread of this disease are critical things for all of us to do together. But we recognize that is not without some cost to individual lives and their everyday daily activities.
Secretary Palm, why are you convinced that self-quarantine would be best for these cruise passengers versus isolating them maybe at a military base?
Well, first of all, we feel they're Wisconsinites. We don't believe Wisconsinites should be put in a position of having to be quarantined in the military. We have the opportunity to bring them home, and we should be doing that. In addition, the ones we're bringing home, they will either have been tested or will be tested immediately after being here. And so, but they've been gone for a long time. It's time to bring them home.
Thank you for that question. I think you will see in our guidance that we peg and link to a new resource on the CDC website, which is tracking sustained community transition, and that is based on the daily information that states are reporting up to the CDC. So that will be a dynamic tool that is changing based on what states are reporting up to the CDC. And so the map that it links to currently highlights California, Oregon, and New York, and New York State as states that have widespread community transmission. And so we are encouraging people as they think about their travel plans, as they are doing their planning, that not only do they look at the CDC website for the latest on international guidelines, which the CDC continues to maintain and update, but that they look at these domestic community transition maps and resources that are linked through our guidance to help them make good decisions about their own travel decisions moving forward.
Are these cruise ship people free to reject the rise to the Wisconsin National Guard, and are they under some kind of military arrest or house arrest? Why are soldiers transporting these people to their homes?
The basic answer is we have an opportunity to have people drive the vehicles. I mean, and people that obviously are trained and following directions, and so no, they are not under house arrest. They're being driven by people that care about them, that are part of our Wisconsin National Guard. They're Wisconsinites taking Wisconsinites home.
Is it because the soldiers have protective gear that their own families can't bring them home, or are you afraid that they're going to disperse across the state?
They want to go home, and some of them don't have family. I mean, so the easiest way to get them home is to get a bunch of people together and drive them home. It's as simple as that.
How many pending cases, how many people have you tested for COVID-19?
So as you know, in recent days, I lose track of time, when we went live with testing at the Wisconsin State Lab as well as the Milwaukee Health Department, and the capacity at the state lab is several hundred tests a day, and we are using that capacity. We are also in constant communication with the private labs that are now starting to get up and running, and expect others in the future to do that. So we are tracking and need to track capacity closely because it has been an issue. We hear from our colleagues around the country about access to tests and needing increased access to tests, and so that is something we are monitoring, and will certainly request additional tests from the federal government as those needs arise.
Should people reject the rise?
What is the number of tests? You're not giving a number. Why not?
Our website has up to date.
It's not in sight anymore.
And we moved away from posting pending tests because the tests are more dispersed now, and so what is being reported are positive results and negative results, and so we do not have full visibility on all of the pending tests that are currently taking place. What we need to know, what we care most about, obviously, are those positive tests, so that they can be linked with public health to immediately start the response that is necessary to contain the disease. But the number of pending cases becomes less relevant because it is not sort of immediately necessary for the public health response.
Can we get a clarification on gatherings of more than 250 people? Wouldn't that include most public schools, and what will be the threshold for closing public schools?
Mm-hmm.
Well, I'll just give you an example. I was just in a public school before I came here, and we had planned a full assembly with 400 kids. I met with groups of 30 kids instead. So it's schools work in different ways, but obviously going forward, they're going to work in a way that minimizes large groups of kids being together.
The U.S. Capitol has been shut down. Should the Wisconsin State Capitol follow suit?
Well, we've already made some things clear as far as tours of the Capitol. We've stopped that, or we're going to be stopping that soon. And we're consulting with the Department of Administration on that. And we're going to know that within a few hours or a few days.
At this point, is there enough access to testing in the state, and do you expect that to change?
Yeah, we are monitoring that closely because we have leaned in on access to testing. We think it's an important part of knowing, or as early as possible, about where the disease is in Wisconsin, and so that we can move into action. We are at a place where we have been able to. Our throughput has not maxed out our capacity. I do think that we anticipate that being the case fairly soon, but again, we are in close contact and are asking for refresh of our supplies for tests so that we can continue to be aggressive about testing for as long as we need to.
Secretary Paul, I think the mayor of Milwaukee says he's able to test 25 to 30 people maybe a day. He wants the potential for 300 to 500. When will he be able to do that if he needs to?
Again, as a state, we are in a place where our throughput is not above the demand for tests. I think that the number of tests that are coming in that are moving through the system. I think that we think very soon we will be beyond the current capacity that we have for testing, and we are asking and working with the federal government to replenish our supplies so that as a state we have the resources we need to do the testing we need to do.
Something the military can also do.
So we do want to expand the labs that are doing tests. These are not simple tests, they're more complicated tests, so you need to have the expertise, the equipment, and then you need to validate that you can perform the test in a way that is consistent and accurate. And so it's certainly possible that there are labs. I'm just not necessarily familiar with if there are, but if they have the capability, they certainly could come online if they wanted to.
That's 4 months out. We're going to be following carefully. Obviously, there's multiple options, but we are in constant communication with them. I would not say that we're planning on doing that, but as time goes on, we'll be in a better position to make that judgment.
Can you give us the ages of the people that have tested positive for coronavirus?
I don't know the ages off the top of my head, but we have been doing our best to protect the privacy of the folks who have tested positive for the virus, and that has not been information that we have been providing publicly out of a desire to keep the identities of these folks private.
We're seeing in other states that they are giving us a sense of the age range so that people can understand who is really getting this. So why not say someone's in their 30s or 40s without specific age? Minnesota, Illinois are providing that information from their health department.
I mean, I think we can certainly consider it. I think we have been leaning on the side of protecting the privacy of these individuals and making sure that the public knows the things that are necessary to protect the public health.
Madam Secretary, how many people a day can you test currently? How many people a day can be tested?
The state lab has capacity to do about 100, in the hundreds of tests a day.
Are there any positive tests?
Not since our announcement yesterday, the 3 yesterday.
You said that the state has the capacity to test 100. The state labs have the capacity to test 100 tests a day. But what is the capacity for people to be tested? Because I think there's a difference. Like how many patients that go to the hospital or how many patients that go to the doctor? What is that capacity? Because I feel like you keep saying like we're at this breaking point. Like what is that point?
So I think the distinction you're trying to make, and that I will try to be more clear about, is when a physician or when your healthcare provider does a swab and sends it off to the lab, you obviously need to do the test in a certain amount of time so that it can be an accurate and reliable test. That sample has a shelf life, and so as we track carefully the throughput of the system, we need to make sure that tests can get into the test before those samples expire, and so that's the balance that we're striking. Does that?
Kind of. I guess I'm still trying to get at if you had 100 people that all of a sudden showed up at 3 hospitals in Madison. A, are you going to have enough of the swabs to test all those individuals? And B, are we going to have the lab capacity to get them tested before that sample expires?
Including private labs.
Yeah. So I guess both questions. What is the sample
Yep.
that you do the swab
Yep.
capacity?
Yep.
Like how much of that is there?
Yep.
And does this public health emergency declaration get Wisconsin more of that? So I guess like the actual swab first.
Yep.
Like how
So that is not a special thing.
Okay.
That is a medical supply that is.
Yeah.
So you don't. It doesn't. It's not connected to the reagents and the test kits that are at the lab. So that's not a capacity problem.
That's all. You're good on that. Okay.
If there is a patient,
Three more questions here.
if there is a patient that you guys end up finding with that it was community spread and wasn't linked to travel, would that change anything about your guys' responses or any other aspect of this?
I mean, it's an excellent point. This is changing daily, rapidly, hourly, and our goal right now is to mitigate spread. It's why we are leaning in and being aggressive with this guidance. I think community spread is a thing where we would have to relook at all that guidance and see if there's anything about it that we need to tighten, we need to do more of, less of, and we will make those decisions as we see this developing. But our goal right now is for everyone to pitch in and help us prevent spread.
Does the state have any plans to help employees that are missing work or any steps taken? I know that they're looking at some options on the federal level.
Relative to employees, yes, our Wisconsin Economic Development Corporation and other agencies that have direct contact with employers. We're working on them. Certainly, we're hoping that employers will be very lenient around the issue of sick leave and what that all means and working from home. Obviously, that can't happen in all cases, but we are working directly with that, and hopefully we'll have, and of course, it's hopeful that the federal government will have some help in this arena also.
Any discussion about how this will affect the state elected population? A lot of people, you shake a lot of hands. This can change how you are going to do your business.
Absolutely it has, and it already has, and it has for the First Lady too. As you know, most politicians spend all their time hugging and shaking hands, and those days are gone, at least for the immediate future. Going to large events are absolutely something neither of us will be going to. The Secretary Palmer stressed an important point. Yes, it is important about all the things we talked about, but at this point in time, one thing we can't control is and minimize is the spread of this, and it's around social distancing. It's around making sure that we're doing good hygiene things, and that has impacted me directly. And it ain't easy for someone who was in a school today and wasn't able to hug one kid or give a fist bump to one kid. That's a problem for me. It's working. I'm working at it. I think I've got it down, but it is not. It is something that, and I don't want to make this all about the governor of Wisconsin. Everybody, I know Wisconsinites. We love to hug. We like to kiss. We love to be friendly. That's why they call it. That's why they call us what they call us about nice Wisconsin nice. Wisconsin nice is going to have a different look to it in the future.
Thanks, everyone.
Great.
Is this your phone? Is that yours?